How do the social issues of health and wellness, including obesity, asthma, healthy food access, and a lack of exercise, affect the academic and school attendance outcomes of KA students? Our research study has examined how health and wellness can affect the academic and school attendance of KA students. Today, it is necessary to have a good education in order to have a stable, prosperous future. Students are now facing the Common Core standards of state legislators and have more pressure to perform well on standardized tests. None of this is possible if our students are not healthy. In a society that is becoming more sedentary, it is important for our youth to begin good nutrition and healthy eating habits at an early age. Research has shown that nutrition does play a role in brain function, cognition, learning, and social behaviors. A child's health habits have an impact on their long-term health. Regular physical activity helps prevent health risks associated with academic performance and school attendance consequences. Regular school attendance tends to produce more successful students. Let's move. The lack of physical activity among children increases their chances of obesity, asthma, and other health-related issues. It has been shown that physical activity helps with cognition, and students who are involved in extracurricular activities tend to do better academically than their peers. Being healthy is essential to students and for students to achieve their full academic potential. Not only is it beneficial for school, but it also provides students with the necessary ingredients of a successful life. The CDC states that physical activity can have an impact on cognitive skills, attitudes, and academic behavior, all of which are important components of improved academic performance. This includes enhanced concentration and attention, as well as improved classroom behavior. It is recommended that children and adolescents should do 60 minutes or more of physical activity each day. The National Association for Sport and Physical Exercise recommends that all elementary school students have at least 20 minutes of recess each day. To show the importance of recess, a recent study found that students demonstrated more inattentiveness as the length between recess periods increased, suggesting that the time. Another study found that students who were provided at least 15 minutes of recess exhibited a high rate of on-task behavior in the classroom that day. Charles Bosch explored the importance of physical activity, and the benefits of it went beyond one's grades. He concludes that dropout rates were lower for youth who consistently participated in interscholastic sport. Though he cautions that forcing kids to join sports won't solve the dropout problem that plagues many schools, it simply may foster an environment of connectedness that could keep at-risk students attending school. Another report by Dr. Giles Hillman of the Department of Kinesiology and Community Health at the University of Illinois, is looking at the relationship between physical activity and processes involved in attention, memory, and academic performance in children. His recent study concludes that physical fitness may benefit cognitive and brain health as well as academic performance. There's a positive association between fitness and key aspects of learning. Obesity is linking to adverse cognitive performance in children and teens. As budget cuts are affecting schools across our nation, administrators are forced to get rid of elective classes that are said to be not as important as core subjects. A lack of physical activity is consistently related to overweight children, as well as other risks such as low levels of self-esteem, high levels of anxiety, and stress. Sheila Fole states, "I don't like obesity being called a disease. We've got to remember that obesity is a symptom. Physical inactivity and poor nutrition are the root causes. A more physical activity and better nutrition are the cures." A wellness impact report in 2013 has shown a link between obesity and academic performance. Findings indicate the presence of a physical fitness achievement gap that has consequences for potential students' future educational and health outcomes. Ken Hill once said, "Food is your body's fuel. Without fuel, your body wants to shut down. Students who are not eating healthy, let alone not getting adequate amount of nutrition at all, can't function to their full potential." There are studies that look at the correlation between nutrition and cognition, although it can be highly under-researched at times. Children spend most of their time at school. Therefore, school play is a very important role in supplying nutritious meals. The National School Lunch Program is a federally assisted meal program that allows us to have children see themselves full and healthy with a balanced meal that they can have every day. This program is in many public and private schools, including residential child care institutions. It provides a nutritionally balanced, low-cost or free lunch to children each school day. This program was established under the National School Lunch Act signed by President Harry Truman in 1946. In today's society, it is vital for schools to provide a breakfast program. There's been evidence in the correlation that nutrition programs have positive impacts on students in the classroom. Schools play an important role in the well-being of their students. There are many programs that can be offered to students in order to maintain or improve a healthy lifestyle. One program that has made strides in helping their students is known as Wellness Works. Wellness Works was created and launched by Kinder and Associates in 2001. The program is taught by a team of teachers in numerous and diverse educational settings. The program responds to contemporary educational challenge by helping students develop the needed skills to address important issues like stress, mental health, emotional balance, behavior, and learning residence. Wellness Works in Schools is designed to motivate, educate, and support students and teachers and families in developing the mental, emotional, physical, and social competencies necessary to handle life's mental issues across a healthy home, healthy school, healthy workplace, and a healthy community. Wellness Works in Schools embraces a whole person, whole child perspective. The program effectively targets those with academic and behavioral issues, including autism, learning support, and emotional support. Children with asthma experience more absenteeism from school compared to children who do not have asthma. Recent studies have demonstrated children with asthma are absent more often when compared with students without asthma, particularly those with persistent asthma. School absences due to asthma and other illnesses may be usually brief, but the pattern of absence has been shown to be harmfully effective in lowering academic outcomes. Moore, Sterling, Figgs, and Castro in 2008 said since students with asthma are more likely to be absent, it may negatively affect the overall school achievement. Findings have shown that excessive absenteeism is related to lower student grades, psychological, social, and educational adjustment. Shepard in 2007 further discussed how parents play a role in absenteeism. If a student is regularly absent from school, a truant officer is called in to look at the situation. This is all done in an effort to support academic achievement. Our research study collected both qualitative and quantitative data in order to learn more about health and wellness and how it can affect school academics and attendance for K-8 students. Through our study, we were able to gain insight on what teachers think are the impacts students' health and wellness issues have on what students think about physical activity and their academic achievement. Our study group included 3 elementary teachers and an administrator at local school in our respective states of Illinois and Wisconsin. Also, we were able to administer a short survey to approximately 35 students amongst grades 5 through 8 to gather their thoughts on physical activity and academic achievement. We did not just focus on one particular grade, but multiple grade levels to ensure the best results of our study. We collected both this qualitative and quantitative data in a process of answering our research questions. The survey allowed us to gather information about the effects of students' academic achievement and their physical activity involvement. Various research questions that align with our research included: how do the social issues of health and wellness, including obesity, asthma, health food access, and the lack of exercise, affect the academic and school attendance outcomes of K-8 students? Some questions that were asked of teachers and administrators included: what percentage of students qualify for free and/or reduced lunch? What are some of the daily barriers that interfere with student learning? What kind of programs, policies, and rules need to be in place to address student health and wellness at a school and/or a district? One example of the respondents answered question number 1 in this way: 2 schools had a very low number of students qualifying at their respective schools at 4% and 6%, yet another school had a very high number of students who qualified for free and reduced lunch at 92%. In conclusion, we believe that further research should be done to continue to look at the health and wellness impacts on student achievement and academic performance. Being healthy is vital for anything that one must do. In order to be successful in school, a person needs to be healthy both physically and mentally. There are many components that can hinder one's chances of being successful. We have chosen this interesting subject because we know that school nutrition, eating non-healthy food, and a lack of exercise can contribute to various student illnesses and lead to increased absenteeism in our classroom. When students are absent on a regular basis, the absences have negative impacts on their academic outcomes as they fall behind in their schoolwork. Our research helped us prove that there are negative consequences for a student's academic well-being if they are not healthy and they are not functioning at a high level as a good and healthy human being and attending school on a regular basis. This will provide negative outcomes in their academic attendance and healthy well-being in life. This report was authored by Ms. Jen Crouse and Mr. Tyrone P. Dumas for ESR 505, National Louis University, March 15, 2014.